How painful is a lower body lift and how long is the recovery?
Pain is subjective and it comes down to you. Dr. Agha does place all of his patients on multiple modalities of pain management, using a pain pump, painkillers, gabapentin, which helps with nerves. There's Celebrex, which helps with inflammation. And obviously the pain pump, which is a tiny little fanny pack. It's a little device that just releases a slow drip of medication right to your incision line. So it really comes down to you. Most patients don't complain about pain.
You know what I hear all the time? I'm so tight. Like, am I ever gonna be able to stand up again?
Yeah.
So yes, you will. Everyone does. But it's more of a tight discomfort than pain.
Yeah.
It's really, honestly, the most painful part from what I hear is the liposuction aspect. It's not even the body lift incision.
That's
right?
very, very true.
Because when the nerve endings or when the sensation's coming back, you get those shooting, like shocky.
Burning, shooting sensation, yeah. And obviously it subsides after a couple of days. So typically recovery for a lower body lift is about 3 to 4 weeks. Something that Dr. Agha likes to tell his patients that I like to also repeat to patients as well is every 1 week of healing is equivalent to 10%. So by week 3, week 4, you're about 30 to 40% healed. It doesn't mean that you're fully healed. You're gonna feel great at week 4, but you're only 40% healed. So continue taking it easy. Using a walker.
Yeah, a walker is really important. And if you're not healed by then, don't worry either, because everyone is different.
Yeah.
And this happens time and time again. People will overexert themselves too soon, and then that's a setback. So you want to make sure that you, just because everything looks healed, and I tell people that from the outside doesn't mean that the inside is all healed. So you really have to take it easy for 4 to 6 weeks at least. And then depending on your work, certain people, if you're able to work remotely, obviously you can start working remotely sooner than that. But if you have a physical job that requires a lot of movement and lifting, then you want to wait longer.
I just wanted to touch on something that you said, overexerting yourself. Take it easy. We do ask our patients to walk quite a bit after surgery. We don't want you just resting in bed for, 3-4 days at a time. We do ask our patients to walk about 100 yards every 3 hours. 100 yards is equivalent to about once around a city block, or it's around, what I like to tell patients, 15 to 20 times around a standard sized kitchen island. So having that walker is going to be a huge, huge help in order for you to get to reach that goal of getting your steps in during the day.
Right.